Welcome to HealthFirst Top Doctors podcast. Today we're joined by leading consultant in general practice and menopause management expert, Dr. Nancy Allen. We're discussing menopause and the opportunities it presents for women to embrace, reset, and take control of their health. Thanks so much for joining us today, Dr. Allen. How are you?
It's an absolute pleasure and joy to be here on Top Doctors on your podcast for the very first time, talking about women's health in the post-reproductive years.
Fantastic. So could you tell us a little bit more about yourself and your work?
My professional background is a GP. So as we all know, when you have issues, the first person you go to is a GP, and we have a lot of breadth of knowledge. And then we decide from there where exactly we need to be referred to. But on top of that, practicing for 25 years, I am a menopause specialist as well. So I take a more holistic view of hormonal changes in the post-reproductive years and actually in the transitional period as well, which is what we call the perimenopause.
Okay, so let's get started with the questions. So what is menopause? And we know that it happens in all women, and it's said to be a very individual process. So while we might be looking out for those, famous symptoms like hot flashes, it also might be quite tricky to pinpoint in certain individuals. So what is menopause?
Well, it's a really good question. And a lot of women seem to think of the menopause as something that's going to happen way into the future when they're much older. And there seems to be a mental image of them being old. But in actual fact, the menopause, the official definition is 1 year after which your periods stop. That is when you are in the menopause. But it's the transitional period of the perimenopause that can last up to 10 years. And in that 10-year window, it's called the perimenopause, where your estrogen output from the ovaries is gradually declining year after year. And it's very subtle, and you start feeling subtle changes. A lot of ladies in my clinic don't actually come for hot flushes necessarily. Some people have a very different experience and not one size fits all. So a lot of them come in with predominantly brain fog, withdrawal, reduced productivity at work, poor sleep, general anxiety. And this is what brings them into clinic. And they don't seem to realize it's associated with declining level of their estrogen, because it does affect the brain. So these symptoms is what brings them in predominantly. Another factor that they lose control over is their figure. So they get a little weight gain during that period as well. The average woman in the perimenopause period can put on a stone in weight. And they often come to me and say they exercise more, they're eating less, and they're burning themselves out, and they gain more weight, particularly around the midriff region. And that's what I'm working on. So when they come in to me, we'll have a consultation, have a discussion, and hopefully within 3 months, I'm able to reset them, get them into the figure that they can higher to the transition or even during that transitional period. And it's very challenging because it doesn't happen just like that. You wake up and like you have a temperature. Oh, I've got COVID or I've got this. You can diagnose symptom. It's very subtle. And a case history, I had a lovely lady, 41 years old. She was a professional athlete competing for county. So very fit, healthy. And she ended up going to her doctors back and forth. They did every single test under the moon. In the end, she ended up going to A&E, just not feeling right, with a lot of anxiety issues. And the consultant in A&E said to me, maybe it's your hormones. So that's why she ended up coming to me through word of mouth and recommendation. So I did a full holistic assessment, not just her hormones. And I realized actually it wasn't the fact that she was in the perimenopause, she actually had anxiety. So this is something that's really beneficial to see a specialist who has a background of general practice. Because if you, for example, went to a pure gynecologist, they would look at your hormones and then you get sent back to the GP. So you're back to square one. So the advantage of seeing a journalist and our specialism in hormonal, particularly in reproductive years, is that we can cipher out a lot of different issues, not just purely the hormonal aspect of it. But in saying that, it's so complex. And with that, you get a lot of what we call vasodilatation, which is pain down below. And a lot of women are so embarrassed to talk about it. Think of it, you're getting discomfort during intimate times with your partner, and they start suffering, and they don't actually, it takes years for them to actually approach it, to the point where a lot of my patients, for example, would complain of having to reach the point of stress incontinence. The amount of ladies who resign to wearing tenor pads and suffering in silence, I'd say the average lady would take about 10 years until they get the courage and get over the shame into speaking to a doctor about it. But again, as a general practitioner with a specialism in that, that's something I'd be very comfortable addressing and fixing.
Fantastic. So what does the individual nature of menopause mean for patients, and how can care be tailored for them on a case-by-case basis?
Well, I think the most important thing is to take a very detailed structural history. And my history pro forma sheet, it takes on board 90 different symptoms, and embedded in that is the latest evidence-based medicine, where there's a lot of mental health issues presenting in the perimenopause. And the worst part is the brain fog. The worst part is the low mood, the low productivity, where she becomes more and more isolated, or anger snaps at her children or her family. Even, I personally had early menopause, and my children used to say to me, you were mean, mummy, in that period in time. I personally don't think I was, but that's the perception of what I was like. But, unfortunately, it does affect your sleep pattern. And I had to wake up at 5 a.m., get ready for work. And not only as a professional person, but I have a family. So it's very challenging to try and be on top of things, run the household, and like feeding my family, good, healthy food. And I think most women take on board that unless, they're in a position where they have a fantastic partner who's a sort of 5-star Michelin star chef as a partner. But most women take on that role of feeding children. So I had all of that to take care of, be at work and be on top form, and so it does take a lot out of you, particularly when your sleep's affected. And I remember when I was going through that period, I used to wake up 3 times a night to empty my bladder. So if somebody comes to me and they kind of take that in their stride thinking, oh, it's acceptable. It's not. You don't have to accept that. You need to come in and speak to a specialist about it so you can get back to your perimenopause state, because women now are living longer, and they are still in that position where actually the older they get, they still are responsible for the family, and the parents now, where you have to the main caregiver for their parents as well, who are aging. So our role has extended from the Victorian period, where we just, mostly women were at home. We had a shorter lifespan, but now women are living longer, still having to work longer hours and perform the roles that they used to do traditionally on top of what they used to, pay the mortgage, do this and do that. So there's more and more pressure on women to perform in bodies that they suddenly don't recognize anymore. Why aren't I sleeping? You try and go to work, give 100% on 5 hours sleep. Not many men could tolerate that.
Absolutely. Yeah, it's definitely something that, we should own. I feel like it's important for women to own it and really understand that they are just as important and deserve that treatment. How important is it to live well, even if you're experiencing menopause? And we've spoken a little bit about it, but is shame and embarrassment something that can stop women from getting help?
Well, yes, I think as women, we are somehow just programmed to get on with it. We just do that. We just get on with it, and that's what we do. Um, Whereas, if a man gets a cold, we call it man flu and we joke about it and have a complete meltdown. We just get on with it because we've got so much to do, caregiving, children, da, da, da. Even if you don't have children, we just get on with it. But, and there's very little education. So if you go to school, they teach you about periods, they teach you about sexual health, having babies, puberty, and then contraception, sexual health. But then it stops there. The menopause is something people just think it's a geriatric condition that will happen well into later years of life. But some ladies can start seeing a decline in their hormones and a change in their bodies and their physiology as young as 35. And it creeps up very, very, in a very subtle manner. So living well is a very good question. So the average health span, which means when you're able to do the activities you can do independently and you support your hobbies, the things you love, is 63. The average lifespan in the UK is about 83, which means you have literally 20 years. So your health span drops after 63. And the lifespan is about 83, which means after that 20-year period, you're not actually independent. And another shocking fact here is that 70% of patients with dementia are female. Why is that? Why is 70% of patients who have dementia female? There's little evidence to substantiate the link between menopause and that, but it raises a lot of questions. So living well is so important. When I say living well is keeping your body mass index within a healthy parameter below 25. And I know it's easy said than done. But I'm a big advocate of medical weight loss, if indicated, because if hormones is stacked against you, your estrogen declines, your cortisol level rises, and what happens then? It causes weight gain. So you can't win. Stuck on top of that, the cost of a living crisis. So a lot of women are working not just one, but two jobs. And being fit and healthy is very time intensive. You need at least an hour to 2 hours a day to get the steps in. I always say trying to get 10,000 steps a day. So when I'm working in a clinic, particularly in my NHS work, I do 10-hour days being duty doctor, which means I try and wake up early and get 5,500 steps done in the morning, in a half an hour walk, and another 5.5 at lunchtime. And that keeps me fit and well. And layer on top of that, and it does take a lot of, I think, intention and a lot of willpower. But if you don't do that, you will lose your fitness, you will lose your stamina. I could end up, before I became very mindful of my body's needs, I used to, on my smartwatch, realize I've only done 3,000 steps a day. That is so unhealthy. Now, there's loads of publications about cardiovascular disease in women and how that increases because unfortunately we just don't focus on our health. So my message today for everyone out there is put your health as a priority. That needs to come first. Whereas previously you put the children first, everybody else work, the children, and your knee, what your body needs comes at the bottom of the pile. And that's the main factor, the message I put at women. You're here with me. And in my clinic, I always spend a good 45 minutes to an hour listening to them and then just understanding what their concerns are and trying to reset their priorities in life.
Oh, that's great. That's really great to know that there's that support available. So, what are the initial steps that women can take to start to take control of their health when it comes to menopause?
I think keep a diary of your symptoms. I
Mm,
think everything, your sleep, write it down, your mood, outbursts, feedback from other people. If you don't feel supported at work, you need to see a specialist because there's a lot of things we can do as reasonable adjustments within work without people, not every environment or practice wherever or whatever field or industry we're in is supported. There are sub companies where are doing great things with having challenges that they're not so ashamed of. So the connection has changed. It has changed. But in saying that, and for keep a diary of how many times you go to the toilet every night, and if you just look at holistically, so a lot of my movies, when they do the questionnaire, the symptom questionnaire, they share it with the husband, and if the husband looks at them, it's like, I didn't really want to suffer like this.
mm,
You do, your how you feel, all that needs to be locked. It's not you. You need help. So don't be ashamed of it. I think you need to embrace your body, work with it, and then I would say eat, cut your carbs, because unfortunately you've got microbiome changes during the perimenopause or menopause, and unfortunately you start becoming more receptive to carbs in a negative way, where you start storing fat more around the midriff region. That increases your visceral fat and consequently increases your tumor score, and your cholesterol increases, your risk for cardiovascular disease increases as well. Now, with shocking statistics, so if your listeners were to go and look on the website to the British Heart Foundation, they've done a fantastic publication, very engaging, that stating that 10,000 women died unnecessarily of cardiovascular disease, and those women could have been saved because, again, we don't really listen to our symptoms, and when we get a bit of discomfort, we just brush it away and carry on. Case history: I had a lovely, fit and healthy lady in her 50s, she walked the dogs every day, very healthy BMI, had a bit of discomfort in her chest, brushed it away for over a week. In the end, her husband said to her, I think you really need to speak to the 111. Before she knew it, she was in an ambulance apologizing to paramedics, not believing or thinking that she had a serious health condition. Lo and behold, she actually had a heart attack.
yeah, yeah. It's really, really sad to hear that, that conditioning in women can really like set us back. So it's just great to hear that there are, like I was saying before, that there is support for people, support for women, to be able to actually access, the right health.
Absolutely.
Yeah, absolutely.
So I
Yeah.
remember when I went through it at the time, it was just as everybody thought, oh my God, HRT means cancer. You're going to get breast cancer. In actual fact, having HRT and living a good, healthy lifestyle and reducing risk of obesity. And a lot of women sometimes mask the symptoms with the mood, with drinking more wine, or, it's their thing. They come home, relax, have a glass of wine. Actually, that increases your risk more of having breast cancer than increasing your lifestyle factors. So that works against you. There is, with HRT, it's the duration of time that you have it. But if you look holistically, the different risk factors, I go into that in detail and balance it, then I think you are better being, if it's appropriate and if it is suitable, you look at the data and look at the risk factors, and on balance, you are probably better having HRT and having minimizing risk factors than not. But everybody is have to be assessed on a individual basis, looking at genes, their risk profile, etc., and not one size fits all.
Yeah, absolutely. Perimenopause, which is the stage before menopause, and it's becoming more widely spoken about. So, is this time a good moment to start considering ways to prepare for the actual menopause?
Well, yes, I would say definitely it's very important, but a lot of women tolerate heavy periods. So
Mm.
if you start bleeding heavily, have irregular periods, having clots after being perfectly normal, you need to actually come and see somebody about it. You can't just sort of, you go to your GP, and yes, they would probably manage that very carefully, but then they don't look at the other aspects where, your mood is affected, your sleep is affected, you're not responding to SSRIs, which is what most GPs commonly prescribe. And ironically, this causes weight gain, and it also causes sexual dysfunction or a difference in sexual satisfaction, which again
Mm.
goes back to affecting your private life. And a lot of women withdraw or avoid having intimate relationships. And the whole thing snowballs. And I would say don't wait until it's too long. And you can have HRT during your
Mhm.
perimenopause, and you
Okay.
can still have a protocol where you can have regular bleeding every month, should you choose to have that. So it's entirely safe to do that as well.
Oh, that's really interesting to hear.
Yes.
Um, yeah. So, the final question, what's the most important piece of advice you'd give to women considering or going through menopause?
I think seek help as soon as you feel things aren't right. Embrace your body, love it because it's taken you to where you are. Life is precious and it's a blessing. I think the most important thing is to speak to somebody who really cares and understands what you've gone through and has the right set of skills. Do not accept to be brushed away or brushed off and told, oh, this is okay. And sadly, sometimes if doctors are unsure, particularly GPs, because I'm a GP myself, you default to a position of not prescribing
Mm.
and will say, well, maybe I'd refer you to a specialist. And sometimes there are a lot of pressures within the NHS system, and it can take up to 12 to 18 months of your life wasted in limbo. So
Mhm.
there are shortcuts you can take to sort of get to the optimal goal and getting into your optimal health sooner rather than later, and just living a happier, more fulfilled life across the board.
Yeah, absolutely. That's brilliant. Thank you so much.
It's an absolute joy and pleasure. So I
Yeah,
hope this has helped all the listeners out there. So take action and just don't accept to be brushed off, and embrace the transition.
yeah, fantastic. Okay, so if you're interested in discovering more about menopause management, arrange a consultation with Dr. Allen via her profile at topdoctors.co.uk.